Glutathione is the ultimate antioxidant in the body. It's also the ultimate detoxifier in the body. It works along with SOD, superoxide dismutase, and there's 3 forms of SOD, SOD 1, 2, and 3, and we have patents on how to handle those correctly. Glutathione and SOD get rid of inflammation. How do they do that? Glutathione stabilizes monocytes and prevents the release of most cytokines. As far as we can tell, all cytokines, but they haven't all been studied. Also, the other problem is they haven't all been studied in the context of using a glutathione that actually works. And I'm involved with the only 2 in the world that actually work. They met our VARS standard. That means they were validated, absorbable, reduced, and stable. Glutathione, as I see all these patients every day with genetic problems, is a thread that's interwoven among all their inflammatory problems. Glutathione is, lack of glutathione is really a root cause for a lot of the inflammation in the world. There are a lot of drugs being looked at and approved lately and getting a lot of airtime for lowering interleukin levels. There hasn't been a specific study, for example, on our glutathione and interleukin 23, which causes psoriasis. But when you search PubMed for glutathione, interleukin, and monocytes, 413 results show up here. You can see it right there. 413 results show up for how they stabilize monocytes to prevent interleukin release. It is cheap, it is very functional, it has no side effects, and it does so many amazing things in lowering cytokines. We've seen great results with our homocysteine problem and cytokine. I need to write an article on that. I'm going to as we collect more data. I want to get 100 patient proof that it lowers IL-8, interleukin 8 in these patients, and it gets rid of their inflammation. We see it over and over again. I've got tons of results on it so far. I just don't have 100 yet. I think it's inarguable when you get to 100, but interleukin 8 is the cause of kidney failure. There's a lot of other cytokines that can cause it, but it's what homocysteine causes to be released. It's the cytokine. Homocysteine stimulates monocytes to release 2 cytokines, MCP-1, monocyte chemoprotector 1, interleukin 8. Interleukin 8 is easy to check levels on. MCP-1's more difficult to check levels on. But if you have a cytokine problem, you may want to look at using something natural like glutathione, more specifically like our VARS glutathione has validation to lower your cytokines. It's cheap, it's effective, it's marvelous, it makes you feel really good. Rarely does anyone have a problem with it. Usually it's from the liposomes we use. It's some far less than a problem. It's about the only problem we ever see. We're trying to figure out how to get around that. We are going to be the first to come out with an intravenous glutathione, and we're going to seek FDA approval. There's a lot out there. They're not done correctly, and we know that. Consider glutathione for your inflammatory skin conditions and other problems. Try it first. Try up to 8 a day for a while. You'll know if it works, because it'll work really well. Try 4, 5, 6, 7, 8. As long as you tolerate it well, as long as the some part lecithin is not bothering you. Putting this out there for the world to consider. Cheaper than a $14,000 a month injectable medication that has a few side effects and stuff, not many, but a few. See if it helps. I don't know. We've cleared up lots of psoriasis cases, and I think it's because of what it's doing to the IL-23, but we don't know that for sure. We'll get more data in as we go. But if you have psoriasis, try it and live a good life. This is Dr. Dan Purser. I look forward to the future. I love RFK and the work he's doing, and thank you much for listening. Bye.